Talk about evaluation, testing, and diagnosis. Evaluation can be like a forensic evaluation or a custody evaluation, and you're doing an evaluation to report findings to a judge or jury or other party. And evaluations can be very simple or they can be very complex depending on the issue and the type of evaluation that you're doing. One of the things that you have to be very clear to the interviewee is that they do have rights and they have rights not to tell you something. And you have to be very clear that you are, even though you are a licensed counselor or a school counselor or whatever, that you are doing this evaluation not as a counselor. You are not their counselor. You are their evaluator. You have to be very clear on that because people will say things to counselors that they should not necessarily say to evaluators. Okay? Um, and also because you don't have the same confidentiality because you're clearly writing a report to give to somebody that's going to be about the discussion that you're having with that person. So they are not a client, right? They're a person you're evaluating. Another thing is that you have to be very objective. The evaluation needs to be completely objective without your opinions in any way and without your bias. So even if you don't like the person that you're evaluating, or there's something about them that triggers your issues, you have to stay completely objective because these evaluations affect people's lives pretty deeply. Boundaries are very important when you're doing evaluations. You should not complete an evaluation for a client. That is a very different kind of relationship, right? An evaluator is there to look at their life, objectively write a report and hand it to somebody, right? A counselor is there to work with the client to help them resolve any issues that they have and become the person that they want to be, right? Very different type of relationship. And again, people will say things to a counselor they should not say to an evaluator. So you have to be very clear. I'm not your counselor in this position. I am an evaluator. The other thing is you have to be competent to do evaluations, right? You must have training and courses beyond the master's degree in evaluations. And I would also seek supervision if you're just beginning your practice in completing evaluations, because a lot of the stuff that you're going to do is going to go to court. And you want to make absolutely sure that you have done everything perfectly. You're objective, you followed very standard procedure, everything, right? And when you go to court, you have to be ready that the opposition will argue that you don't have the credentials to write an evaluation. They're going to attack the process that you use to complete the evaluation. And they're going to attempt to get you to contradict your statements. And they're also going to bring other experts to contradict what you're saying. So it's not easy to do evaluations, but people who like doing them and do well with them have a really good time. You just need to realize that completing an evaluation or being an evaluator is very different than being a counselor. Now, testing or assessments, it's really assessments, are things that we do as counselors, right? You're going to take assessment and counseling course, clearly. So that's one of the things that's important. You have to have training, and you will. If they're very complicated assessments, they might require another workshop or some other type of training. When you use assessments with clients, you need to think about, is this test valid for your client? Are it, there are a lot of diversity issues with assessments. So you need to talk about these in the informed consent. You also need to think about, what is this assessment used for? What does it measure? And how will you interpret the results? And these are things that it's really important in the informed consent, the discussion that you have with your client before they complete an assessment is why you're doing this, right? Has this assessment been normed on similar type clients? Because if it hasn't, it might not be valid for your client anyway, right? Really important to think about. And anytime you give a standardized assessment to clients, and this is what we're talking about specifically standardized assessments, because we do assessments all the time. How are you feeling today? How is your depression on a rate of 1 to 10, excuse me, all those kinds of things. But these are standardized assessments that are published assessments, right? That we're talking about. And so the informed consent process around that is really important. Clients also have the right to back out and not take the assessments, and that's really important. You want them to complete the assessment in the same room that you're in, or at least near you, because you want them, if they have any questions, you want them to be able to ask you questions. If something comes up, if they read something and it worries them or triggers something in them, you don't want them to be home when that happens. So it's important for them to complete the assessments with, either with you online as they're completing the online assessment, or with you in the room, or them in your office, whatever it is, okay? Interpretation is really interesting, because if they complete an electronic assessment, that usually spits out a report, and you're not necessarily wanting clients to look at those directly, because when we interpret assessments, we interpret them a little bit differently sometimes. And we interpret them individually for each client than what a report would just spit out, not knowing who your client is, right? So that's one of the things that you have to be careful about. And you have to inform the client the basis for the interpretation. And you don't speak in absolutes. You don't say, well, this obviously says you should be a silversmith, so that's what you should do, right? But it's more of, this is information to help you understand more about yourself, or the things going on around you, or your stress, or whatever it is that it's measuring. But it's not an absolute, and assessments are not 100%. And you need to be very clear when you talk to clients about that. If you are giving electronic assessments and not traditional paper and pencil, you have to think about HIPAA compliance, right? If the computer is connected to the internet, how is the computer protected? Where is the information for the assessment stored? Because sometimes it emails you reports. Well, if that's the case, right, then where is that email encrypted? Is it protected? Is it HIPAA compliant? So those are some things to think about if you're utilizing electronic assessments with clients. Now, again, what I just talked about, when you choose an assessment, you really want it to be valid and reliable. Valid means it measures what it's actually supposed to measure, and reliable means a client can take it a couple of times and it will have very similar results. So those all published assessments have that information, right? And if the assessment doesn't provide that information, then it's probably not a good assessment to use. The other thing, as I said before, is you have to think about diversity, right? Who was this normed on? The majority of assessments out there that are published are normed on white males. Might not be appropriate for your clients. The other thing you have to think about is the assessments tend to be very biased. The language around them, all of that, can be biased and very specific to majority culture. And if your client hasn't had those same experiences, then maybe they'll complete the assessment differently. Counselors also, believe it or not, develop and publish their own assessments or tests. And when you're doing that, you have to be very clear on the procedure, the scientific procedure that you're following to validate to the assessment. All of those things are extremely important to follow, right? Because you're publishing an assessment that people are going to read, interpret, and think about themselves in terms of that assessment. The other thing is, you have to think of the security of the actual assessment, the physical assessment, whether it's paper or electronic, because these tests rely on the fact that clients maybe complete them once or twice, but they don't know the questions. They haven't seen the questions. So if an assessment is passed around, gets on the internet, and everybody can read it, although there are some on the internet, but then that might mess with the the validity and reliability, well, not the reliability necessarily, but the validity surely of that assessment. So those are some things to think about. Generally, when you have assessments in practice, you keep them in a locked, if they're paper and pencil, you keep them in a locked area, so that because they have to be administered only by people who are competent, so by you, let's say, right? Well, let's talk to a little bit about diagnosis. Now, you can use assessment instruments to help diagnose, and diagnosis is a different form of assessment. Diagnosis is when you determine, based on usually the DSM, which is a book of diagnoses, what's going on with the client, what criteria do they fit in terms of this designation, right? So each diagnosis, each type diagnosis, for example, ADHD or bipolar or anxiety, right? They have specific criteria that need to be met for someone to be considered having that diagnosis. And there's a huge controversy around counselors and diagnosing, because we are very much about the wellness model, right? And diagnosing is very, very much the medical model. So the idea is, how can you justify, if you're looking at the whole client and you're focused on the wellness model and what helps the client and what positive things we can use to help the client, how can you possibly diagnose? Well, the truth is that we have to diagnose for insurance reimbursement, and also diagnosis, if it's done appropriately, can give your client information about themselves, but you also give you information about how best to treat them based on the research that's out there, right? So that's very helpful. Now, there's 3 things that we have to think about ethically when we think about diagnosing, and one is, again, that it's the medical model, and the medical model tends to pathologize the problems of racial and ethnic minorities, because they tend to be diagnosed with more severe diagnoses. And we have to think about how the medical model, or how someone using a medical model thinks about our clients of color or our LGBTQ clients. We have to really think about that, because we're going to diagnose this person. Now, are they going to be looked at differently because of this diagnosis? The other thing is that giving a diagnosis, like I said, tends to pathologize the issues, and it adds to oppression. It perpetuates this paternalistic approach to mental health care. Here's what's wrong. Here's how to fix it. I'm telling you what to do. Go fix it, right? Which is not how we work as counselors. And having this diagnosis does tend to, for some people, they focus only on this diagnosis when they're treating clients, and it does tend to make them more of a parent figure rather than someone who's working with the client, right? Because our whole point is for the client to be independent. So this can reinforce societal oppression of women and minority clients. So those are some of the things we have to think about when we're thinking about diagnosing. Now, there are questions about, are counselors allowed to diagnose? In most states, yet. In New Jersey, yes. A diagnosis class is required for licensure, so you have to be licensed to diagnose. School counselors are not allowed to diagnose. And you do, and in our clinical mental health counseling course, there is a clinical assessment and diagnosis course. So clearly that course meets the state requirements. And one of the things you have to think about, one of the things that you learn in when you're learning about diagnosing, is that there are things called downcoding and upcoding. Now, downcoding is diagnosing something less intense to protect, with the idea of protecting clients, right? To reduce the stigma that they're going to have because of the diagnosable disorder. So somebody has depression, but you diagnose them with an adjustment disorder, which is a pretty benign diagnosis, but still can be paid for with insurance companies will still pay for it. Upcoding is exactly the opposite, right? So they have a diagnosis that's considered a V code, which V codes are not payable by insurance companies, and you upgrade that to an adjustment disorder or depression in order to have insurance companies pay for the counseling sessions. Neither one of those is an ethically appropriate thing to do. Either one of those could harm clients. So you have to be very careful about doing that. You're actually not supposed to do that. It is unethical. Okay. It is unethical to give clients a diagnosis that isn't their actual diagnosis, even if you have the best intentions. Right. The other thing is that we should involve our client in the diagnosis and the diagnosis process. We should talk to them about the diagnosis, why we believe that that diagnosis is correct, and ask them about diagnosing them with that issue, right? With that particular diagnosis. Because I do know that there are counselors that just diagnose, send it off to the insurance company, and don't talk to their clients about it. And then the client finds out that they have this diagnosis that they had no idea, right? That is not the way to do it. That is unethical. So make sure that you involve your client in the diagnosis. As always, if you have any questions, please feel free to upload them to Canvas or bring them to class.